Here are 5 crucial pieces of gynecological information that could be useful at any stage of your life. You could potentially save someone's life someday if you know these 5. These problems are more common than you think, so you can be a hero. Surprises are only good for anniversaries or birthdays. We never like surprises about our own health, do we? Today we discuss 5 different gynecological surprises and, more importantly, how to avoid them. Number 1. Avoid ovarian cyst surprises. If you have a cyst in the ovary, first check whether it's a simple cyst or complex cyst. You can do it from your own ultrasound report. You don't have to be a doctor to know that. Cysts are very common and not all require treatment or surgery. However, once a cyst is discovered, you must check the ultrasound report to understand the most important detail, whether it is simple or complex. Complex cysts have a higher risk of further complications and a greater chance of developing into cancer compared to simple cysts. According to international guidelines, all ultrasound scan reports on ovarian cysts should follow the IOTA or ORADS classification system. For example, ORAD system assigns a definite number to the cyst based on various ultrasound characteristics, dividing them into 6 categories from 0 to 5. If the cyst scores 3 or more, a completely different treatment approach may be needed, and you should consider consulting a gynecological oncologist. This does not mean the cysts are cancerous, but it suggests that these cysts should not be managed like any other simple cysts. The treatment approach may vary depending on whether the cyst is a simple, fluid-filled sac or a complex cyst containing other substances. Your ultrasound scan report will likely to be in English, so check for these parameters and discuss them with your gynecologist. Ask about the complexities and additional treatments that you might need. Here are some important terminologies to be cautious of if they appear on your report. Septum within the cyst, or the terms multiseptate or multilocular areas, solid areas, papillary projections, heterogeneous cysts, irregular cysts, cysts with increased blood flow. To check for increased blood flow, a colored Doppler flow test is necessary. If your cyst has these characteristics, it may be classified as high risk according to the 2018 ORAD system. Remember, your treatment plan may differ from someone else's because each person and each cyst is unique. To avoid future surprises, be proactive. As mentioned, the first step is to determine if the cyst is simple or complex. Number 2, avoid pap smear trap. Even if you have taken cervical cancer vaccine, you must continue to have regular pap smears. It is undeniable that cervical cancer vaccine is a significant leap in medical science. Its inventor, the German scientist Harald Zerhausen, was awarded Nobel Prize in 2008. The introduction of these vaccines is expected to be very valuable in cervical cancer prevention and will likely increase the average life of women globally. Cervical cancer is mostly caused by a virus known as human papillomavirus or HPV. It is relatively easy to develop a vaccine against that virus, and naturally we now have a vaccine against cervical cancer. However, there is a misconception among women that if they take the cervical cancer vaccine, they do not need pap smears. This misunderstanding could lead to missed opportunities for treatment. Not all cervical cancers are caused by HPV. While the vaccine will mostly prevent cervical cancer caused by HPV, it will not prevent cancers that originates without the influence of virus. Interestingly, the number of non-viral cervical cancer is increasing. Therefore, international guidelines still recommend having a pap smear every 3 years between age of 25 to 50 and every 5 years between the age of 50 to 65. To avoid future surprises, please do not forget to have regular pap smears. Number 3. Surprise bleeding after menopause. First, find out the causes if you experience any bleeding after menopause. At a certain age, bleeding stops, which is known as menopause. Every woman will go through menopause and it is permanent cessation of bleeding. However, Some women mistakenly believe that it is normal to resume bleeding after menopause. This is absolutely baseless. Menopause means a permanent stoppage of bleeding. It is important to understand that some medical terms are derived from ancient Greek or Roman languages, which can be confusing. The pause in menopause does not mean that the menstruation will resume again. Any bleeding after menopause is, by definition, abnormal. This does not mean that it is always cancer, but it is crucial to find the cause of this bleeding. Even a small amount of bleeding after menopause should be investigated, as women are used to seeing bleeding every month and may not be alarmed by little bleeding after menopause, which almost in itself stops. A basic investigation involves a transvaginal ultrasound scan to check the thickness of the inner lining of the uterus. If it is more than 4 mm, further investigations are needed. In menopause, the estrogen drive in a woman's body finishes. So, the inner lining should not be thick. Besides a transvaginal ultrasound scan, you should also check the health of the cervix. Remember, postmenopausal bleeding is not treated like any other bleeding in a woman's life. Stopping the bleeding is not as important as finding the cause. Treating the cause is a great scope to avoid major health issues in future. More so, if the woman has diabetes or high blood pressure, extra caution is needed. Number 4. Gas, acidity, ovarian cyst link surprise. Avoid surprises. If you have got problems with gas or bloating in your abdomen, get an ultrasound scan to check the ovaries. Most ovarian problems manifest as gas issues, and ovarian cysts may not show gynecological symptoms. If you have gas problems, feel bloated soon after eating a small amount of food, or have urinary or bowel issues, never forget to get an ultrasound to check the ovaries. If you have gas or indigestion problems and the ovarian cyst, especially a complex cyst, you must see your doctor to check the nature of the cyst. If your symptoms disappear but the cyst remains, go back to your doctor for a thorough checkup. Avoid surprises. Number 5. Avoid surprises with fibroids. Most uterine fibroids are benign and non-cancerous, and many do not need any treatment. What are fibroids? Uterus has got 2 layers. The inner layer, known as endometrium, which sheds every month and manifests as menstrual bleeding, and a muscle layer or myometrium, which is constant throughout a woman's life. Fibroid develops as a tumor of this muscle layer. We have numerous videos and blog posts on fibroids. All links are below. Read them for more information. However, confusion about uterine fibroids persists. If a fibroid is small and occurs in a menstruating woman, it often does not need any treatment. The role of medicine in treating fibroids is minimal. Science has not discovered effective medicines for fibroid. 1 or 2 medicines were discovered, but one was found to be harmful to the liver and has been banned in European countries, though it is still used in India. Please use caution. On the other hand, the fibroids that are increasing in size, causing bleeding problems, especially those leading to anemia or developing after menopause, needs to be critically assessed and often require treatment. Today, surgeries have become much more advanced. Get advice from your doctor to ensure you receive the right treatment. Understand that if your ultrasound or scan report identifies a tumor as fibroid, it may not actually be a fibroid. If there is suspicion that it could be different type of tumor disguised as a fibroid, get detailed opinion from your doctor before undergoing surgery or treatment. Reading links to our fibroid masterclass posts will give you a clear understanding on these problems. Hence, you must be cautious from the beginning. That's all today. See you soon on another topic.